Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
And today we'll be talking about perineal massage, its benefits, and how you can empower your patients and educate them.
So, Melissa, what is a perineal massage exactly, and when do we recommend is a good time to start doing it?
Yeah, so usually we recommend starting perineal massage at around like week 36 of pregnancy. That's when it's really important to start doing it at least like 3 or 4 times a week, spending anywhere from 5 to 10 minutes, whatever you can tolerate. The perineal massage is really just desensitizing and building proprioceptive awareness of that perineum so that the patient is a little more familiar with that area. You're promoting blood flow, decreasing some of the hypersensitivity that comes with the pressure from pregnancy, and then just getting that tissue ready for a vaginal delivery. We also will have, when you're that far along, it's very hard to do this yourself just because of your body
Absolutely.
mechanics. So we do have partners come in to learn this technique to do on for their partner. So,
Absolutely.
Kathy, how do you talk to patients about how to do a good perineal massage?
Yeah, absolutely. So, making sure washing hands with fragrance-free soap, so that we're not introducing and no chemicals of concern soap, so you're not inadvertently introducing something internally
Mhm.
that you don't want to, that's going to disrupt that vaginal microbiome. And then, starting with the thumb or the index finger, depending. And I have, so for example, I'm having a partner, if I'm teaching a partner, standing on the right side of the person, if you're going to work on the right side. And
Mhm.
then usually like going in, right? And I don't use like the IP, I'll say, just go into this first knuckle and go in. And then you want to just, again, it's very similar to that bulbospongiosis release. And you want to make sure that you're on, the biggest thing is that you're on the muscle and that you're not like just like pulling the skin, right? Like you want to help people to learn that it should feel like going into this part of their hand. It should feel dense, like you're going into a muscle. And then, you know, helping the patient, their partner to understand that analogy of the clock, right? So if 12 o'clock is up here and 6 o'clock is down here, and you really want to be going on the bottom part, like really between 4 and 8 o'clock, and very gentle, sustained pressure going between 4 and 8. And I'll often grab their hand or maybe even their arm and
Mhm.
demonstrate the difference between like pulling on the skin and then just kind of like gently sinking into the skin. So at least they also, the partner, starts to build that proprioceptive awareness of the difference between like a gentle sinking into the muscle versus a pulling of the skin.
Yep, and you want to do it between like that 4 to 8 o'clock, at like kind of the bottom of the perineum, like all along that area. And it does help to, it can help with reducing, risk of tearing, but mainly it's so helpful to just build a patient's awareness to that area. And you can use the time to do some diaphragmatic breathing, work on pelvic floor relaxation while that's being done and really preparing for a vaginal delivery.
And it's a beautiful way also if the partner's helping for the three, so partner, mom to be, and the baby, it's a really nice opportunity for those three, that family unit to bond in a very special way.
Mhm.
Melissa, I did have a question. What about the use of lubricant?
Yeah, so I think that's a choice for the patient. I usually don't recommend using lubrication. However, because when you're pregnant, you already have so much lubrication that you don't often need more. But that's totally preference and it doesn't matter. The lubrication will make it a little bit like you'll slip a little bit more, and you may not be able to provide as much sustained pressure. And that's kind of the point of the perineal massage.
Mhm.
But if there's too much burning, um, and just like too much sensitivity, then you may need a little bit. So kind of go by what your patient needs or what your partner needs for that.
And always a good cue for your pregnant person and the partner is just drop your shoulders away from your ears and just, that's a super helpful cue. So as soon as you do that, it helps mom to relax and it also helps the partner to relax. And then
Yeah.
as they go to sink into that tissue, it's going to be a very gentle, heavier sinking in and less of a like, oh my gosh, right? Because there's a lot of oh my gosh when
Yeah.
you're 36 weeks pregnant and on.
Definitely.
So
Yeah. And, it should be uncomfortable, but tolerable. So it should never be so painful that you have to stop, but it shouldn't be comfortable. And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues.
and subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. And you'll get access to our weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we post more pelvic health tips. We're super excited to announce we're developing an online pelvic health course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.